Hello, I'm Dr. Will French for the Joint Telepsychiatry Toolkit for the American Academy of Child and Adolescent Psychiatry and the American Psychiatric Association. I will be talking about telepsychiatry in a youth system of care. A system of care is a spectrum of effective community-based services provided by child-serving agencies or systems organized into a coordinated network of resources for youth and their families who have or are at risk for mental health disorders or other challenges. The system of care philosophy asserts that mental health care should be provided to children in the least restrictive, most naturalistic setting available and be constituted such that ideally, regardless of the service needs of a given patient and family, a matching level of service intensity can be organized and delivered successfully, thus decreasing the need for out-of-home placement. As it was originally formulated, the system of care concept was intended for youth defined as having serious emotional disturbances, but over time, this designation has been dropped, allowing a broader range of children and adolescents to benefit from having their care coordinated among the various child-serving agencies, programs, and supports serving them. At the practice level, the wraparound process has become one of the most commonly used approaches for individualized service delivery for agencies and programs operating within a system of care framework. The wraparound process refers to an intensive, individualized care planning and management for youth with mental illness who would benefit from a higher level of service coordination. When delivered with fidelity, wraparound has demonstrated effectiveness in improving healthcare outcomes and patient and family functioning. Wraparound has been associated with reduced hospitalization, decreased out-of-home placement rates, and higher rates of school attendance. The wraparound process is consistent with a system of care approach as it is a family-driven, youth-guided, and team-based service planning intervention that relies on a care coordinator to link youth and family to needed clinical and non-clinical services in a flexible way depending on the individual and family's needs. Various natural support partners and clinical providers in a child system of care focus on building meaningful partnerships with families and youth, identifying both the strengths of the children and families as well as areas in which they require more support to help them function better in their homes, schools, and communities. Potential team members may include primary care providers, psychologists, social workers, parent and peer support partners, and other non-clinical natural supports identified by the family. Although child psychiatrists have not traditionally played an integral role in wraparound service planning, there has been a growing awareness of the important role child and adolescent psychiatrists can fill in the wraparound process, and more broadly in system of care interventions at individual, program, or larger systems levels. Telepsychiatry, by removing a critical barrier to access to care, is becoming an important mechanism to increase the capacity for child and adolescent psychiatrists to participate in and bring their expertise to a child system of care team. Many youth at greatest risk of adverse mental health outcomes live in communities with inadequate access to mental health services, let alone access to subspecialty providers such as child and adolescent psychiatrists. By engaging distally as a member of a network of providers in a system of care, a telepsychiatrist can positively impact care in a number of useful ways by providing 1. Comprehensive mental health evaluation and treatment recommendations. 2. Psychopharmacological prescribing or deprescribing, either directly or through consultation with current prescribers. 3. Information regarding recent advances in evidence-informed treatments, programs, or practices. Or 4. Referral resources and sources of support which the broader team might not be aware of or otherwise have access to. While the above examples highlight the potential for telepsychiatrists to directly impact the care of individual patients, there's also the potential for telepsychiatrists to become involved in system of care functioning at the program or higher systems level. For example, a telepsychiatrist could serve a role in helping introduce and monitor quality improvement efforts. He or she could provide trainings in evidence-based care interventions and measurement-based care. Or the telepsychiatrist may be asked to participate in efforts to help the identified system or program undertake a population-based approach to providing preventive services to a community. At the state level, a telepsychiatrist could be part of a statewide effort to prevent unnecessary, costly, long-term psychiatric residential placement for patients who might be able to remain in their community if less restrictive options could be identified that equal or approximate the care provided at available residential facilities. Serving a community distally presents unique opportunities and challenges. The expertise made available through telepsychiatry can help coordinate care, add additional tools for care, e.g. assessment and prescribing skills, and monitor and/or improve the quality of care being provided by local therapists or other caregivers. However, telepsychiatrists are at a disadvantage in that they do not live in the community and may not be familiar with the local language and culture. Also, they may not always clearly understand the strengths and limitations of the agencies or programs they are partnered with, which could lead to uncertainty regarding the quality of the treatment interventions being provided or the strength of the relationship between the patient and his or her family and the agency serving them. To overcome these challenges, telepsychiatrists are encouraged to learn as much about their patients and families and the communities where they live. If possible, they can make annual or semi-annual visits for meet and greets with their patients' families and team members. Additionally, they can organize problem-solving lunches via video conferencing if needed. They can also reach out to local teachers, school administrators, primary care providers, and pharmacists. Over time, such efforts can reduce the feeling of being an outsider and improve the trust among team members, patients, and their families, and the telepsychiatrist. Taking such challenges as a given, a motivated telepsychiatrist, by choosing to work in a child system of care, can advocate for and help build cohesive and comprehensive networks for children that positively affect their mental health functioning. I'm Dr. William French for the Telepsychiatry Toolkit. Thank you for watching.